Hello, I am going to be going over the common sleep disorders that we are going to talk about. I'm going to explain their symptoms, their causes, why it's happening, and then or what's happening in the body, and then treatments for each. So first we have sleep deprivation. Symptoms include constant fatigue, mood swings, poor concentration, and weakened immune system caused by not getting enough sleep, either due to lifestyle choices, work demands, or health conditions. Sleep is when your brain consolidates memories and your body repairs tissues. So without it, stress hormones increase and cognitive function drops. Treatment for this would be prioritizing sleep hygiene, which is regular sleep schedule, no caffeine late in the day, and then reducing screen time, especially at night. And also cognitive behavioral therapy if psychological stress is involved. Next, we have insomnia. Symptoms for this would be trouble falling asleep, staying asleep, or waking up too early. This leads to irritability, poor focus, and low energy throughout the day. Causes for this are often linked to anxiety, depression, stress, or just poor sleep habits. Overactive mind and stress hormones like cortisol disrupt normal sleep wake cycles. So, if you have high stress and if you have high cortisol, your sleep is not going to be regulated properly. For treatment, CBT, which is cognitive behavioral therapy for insomnia, relaxation techniques, and then sleep hygiene. In some cases, short-term use of sleep aids or melatonin are also helpful. And then we have sleep apnea, which is loud snoring, choking during sleep, or daytime sleepiness. This is also interrupted breathing during the sleep, which means your breathing can stop for 10 plus seconds multiple times a night. Causes from this, obstructive sleep apnea is the most common, which is caused by the throat muscles relaxing and blocking the airway. So, like the brain signals and stuff, it's not working correctly. So, the brain detects the lack of oxygen and briefly wakes you up, preventing deep sleep because, again, your brain doesn't want you to suffocate. CPAP machine is a good treatment, which stands for continuous positive airway pressure. This helps keep your airways open during the night. And then weight loss could also help, avoiding alcohol before bed, or in severe cases, surgery. And then we have narcolepsy. Some symptoms of narcolepsy would be sudden sleep attacks and excessive sleepy time or sleepiness during the day. This may include cataplexy, which is sudden muscle weakness, hallucinations, and sleep paralysis. Causes, it is often caused by hypocretin or cretin, a brain chemical that regulates wakefulness, and if you have autoimmune issues, it may destroy these cells that produce it. Treatment for this would be stimulant medications for alertness, scheduled naps, lifetime management, and safety planning, especially for driving or if you work with heavy machinery or whatever it is. Next, we have hypersomnia, which is excessive daytime sleepiness even after long nights of sleep. Trouble waking up and functioning during the day. Causes for this, it could be idiopathic, which means there's an unknown cause, or it could be secondary to other conditions like depression, head trauma, or sleep apnea. Causes could also be dysregulation in sleep-wake signals in the brain. So there's that chemical malfunction. Treatment could be treating underlying causes, stimulants to wake promote or wake promoting agents like modafinil, improve sleep hygiene, and avoid alcohol or sedatives like melatonin at night. So your body knows how to regulate that by itself. Next, we have restless leg syndrome, or RLS. Symptoms for this would be uncomfortable urge to move your legs, especially in the evening or at night. Temporary relief with movement, which often disrupts your sleep. Causes could be linked to dopamine dysfunction in the brain. It also could be hereditary or related to iron deficiency, kidney disease, or pregnancy. Treatment for this could be iron supplements if you have a deficit in your iron, dopamine agonists or anti-seizure medications, or avoiding caffeine and alcohol and trying to establish a regular sleep routine. So that's it for the sleep disorders. These conditions can deeply impact quality of life, but as you can see, proper treatment and awareness, with proper treatment and awareness, it can be managed. Thank you.